Hi everyone, my name is Dr. Danielle Cooper. I am a plastic surgeon here in the Dallas area. I'm making videos for a couple reasons. One is that I am very passionate about what I do as a plastic surgeon, and so I love being able to share that information and educate people on what it means to be a plastic surgeon and different procedures that we do. The other reason is I wanted to just put myself out there to be an inspiration for others that might be interested in pursuing a career in medicine or any other field where you might not see too many people that look like you. So I'm hoping to just, again, kind of be that inspiration for anybody out there that is looking to pursue those types of careers as well. So I will start off with this first video just talking a little bit about myself, but if there are any other questions that you guys have or topics that you think would be good for me to discuss, please leave them in the comments below and I will be sure to make some videos to answer those questions. So I am originally from Louisiana. I was born in Baton Rouge and I played volleyball and basketball when I was a kid, and that took me essentially to or allowed me to get a college scholarship at Xavier University in Louisiana. It is an HBCU, or Historically Black College or University, in New Orleans, where I played basketball for 3 years, and then my last semester I played volleyball. It was actually the first volleyball team that was brought back since Hurricane Katrina. But during that time at Xavier, I was a biology pre-med major. So it's a little difficult being a science major and being an athlete, but it can be done. And from there, I went on to Johns Hopkins Medical School, where I did 4 years there in Baltimore. And that was one of the most amazing experiences that I had. I was one, I think there were probably 10 African American students in my class of 120 students at the time, and we all became very a close knit group, obviously, and they are still like lifelong friends of mine that I talk to almost on a daily basis. So that was a really good experience, and while in medical school, that allowed me to get more exposure to the field of plastic surgery. Actually, my interest in plastic surgery started when I was in middle school. Because when I was a kid, I had a staph infection on my face that resulted in, that needed to be drained essentially. It was right underneath my lip here. Had to drain it, and they had to let it heal in on its own, which resulted in forming a thick scar that I was very self-conscious about. Ultimately went to a plastic surgeon to get a scar revision surgery, and it drastically changed my self-attitude, my self-perception, my self-esteem. And that's when I knew, I was like, that's what I want to do. I want to be in a field where I can make such a substantial difference in how somebody feels about themselves. Just from that personal experience, that kind of put me on that trajectory since then. So I went into medical school at Johns Hopkins already knowing that I wanted to do plastic surgery. And I got involved in the department there. I did research. I shadowed in the operating room. I was in the operating room as a first year medical student because I already knew that that's what I wanted to do. And doing so, and spending time with the Department of Plastic Surgery there at Johns Hopkins, it just solidified that I had made the right choice of pursuing this as my career choice. So it was a stressful period because obviously it's medical school. It's not like, undergrad can be hard, but medical school is on a whole different level. They make the analogy, it's like drinking from a fire hydrant or a water hose, because there's so much information that's just being shot at you at once, and you're trying to figure out how to essentially down it all without drowning. So it was a big adjustment going from undergrad to medical school. But again, with, I think, having strong family support, having strong friend support, I was able to finish medical school and match into a plastic surgery program at Washington University in St. Louis. So from Baltimore, I traveled to the Midwest in St. Louis, and my plastic surgery residency was 7 years. So that's 4 years of undergrad, 4 years of medical school, 7 years of residency, where you start off as an intern. You are pretty much the frontline in the ER or on the floor managing patients that have issues overnight and have issues in the emergency room. And then as you progress in your training, you get more and more hands-on experience in the operating room, to the point where pretty much at the end of your training, you're operating without really the need for any assistance from your attendings. And so, like I said, it was a 7-year program for me because I did take a year off to do research. And at our program at the time, it was an optional year, so I decided to take that year. Also, during my residency, I got married. I had 2 kids. I have 2 little boys. That made residency even more challenging, but fun. So I know that that's something that a lot of females are cautious about, as far as either pursuing a career in medicine, or particularly a career in surgery. Is it possible to have a family and have children, or do I need to wait until I finish training to do that? And I will say it is possible. I've done it. I know a number of other female doctors, surgeons that have done it. It is not easy, but it is possible. And I think if you have a good support system, or you figure out a way to have a good support system, that you can make it happen. And I think that a lot of programs are starting to understand the importance of having well-rounded residents. So they are starting to kind of get on board as to what can they do from an institutional level to help support their residents that are interested in growing their families during that time. So like I said, after residency, I have then accepted a position at a practice here in Dallas. So I'm at Fresh Image Cosmetic Surgery Center. I joined a facial plastic surgeon. His name is Dr. John Standifer. He's been in the business for over 30 years. So it was great for me to be able to come in and add to the practice. So like I mentioned, he's a facial plastic surgeon, so that means he works from the neck up. And I have done my training in all general plastic surgery, so I work full body, face, breast, and body. So I came to kind of bring that aspect to the practice. So I'm super excited getting started. I hope to just continue to make more of these videos to inspire, inform, and educate people that are interested in what I'm doing here. So again, like I said, if you have any other questions or other topics that you'd like to hear me talk about, just leave them in the comments below. All right, guys, take care.